Ooh, that one. That's the bad spot. There. Do you hear a crack?
Yeah.
There you go.
Yeah.
So dogs have 7 bones. Good. That was the atlas adjustment. We have Jen, the owner, and Mom to Blue, the dog. What type of breed is Blue?
He's a Bernedoodle.
A Bernedoodle. Okay, did you know that you were a Bernedoodle? And he's 5.5 years old.
Yep.
And then approximately, 2 months ago or 3 months ago, you noticed something?
Yes.
And you noticed that he wasn't playing the same way. He was hesitant to jump on the bed or do the couch,
yes.
the things that he used to do effortlessly because he's got a lot of energy. You also suspected some tender points.
Yes, in his lower back.
Lower back, okay. And then you went and did your veterinarian thing.
Yes.
And they did their work and they said, what did they say, that it might be the lower back or?
Yeah, lower back might be IVDD, a luxating patella, and then they just put us on anti-inflammatory.
Okay, and let me unpack that really quick if people are watching that don't know. So luxating patella means like a kneecap that won't hold in position. And that's something I work on a lot in my office. And it turned out it wasn't that. And then the other was IVDD, which is intervertebral disc disease or like arthritis in the spine. And quadrupeds, 4-legged animals, typically get it like right here where the thoracics meets the lumbar. Since they have 13 bones in their thoracics, we have 12. It would be the 13th bone and then transitioning to the first lumbar. So it's like T13L1. And it can be all in that area, so it doesn't have to be that exact segment. But they search for that. And then they eventually gave you some meds too, and that's what happens. And then they also said it could be a behavior thing,
yes.
right? You know, that maybe you just lost your motivation or something.
Yeah.
So, and then you found me somehow, right?
Yes.
Okay, so today's their first time in the office, and I'm gonna do what I do is just, if Blue is okay with it, I'm gonna work with Blue from head to tail and see what we can find and see if there is an area that might have got wrenched from jumping off the couch or whatever dogs do, right?
Yes.
Okay, good. Can I work with you today? Okay, I like to ask. It's always good to ask. Is it okay if I start?
Yes.
I always ask consent. I feel that's important. Okay, so Blue, we're gonna first just check a range of motion and neck, because as a 5.5-year-old, you should be able to move your head pretty easily. And there, the nose touches the left shoulder blade, touches the right shoulder blade. That's really nice. If anything, we're gonna spin it towards you. And I want to do a head tilt up, and let's see, there's a lot of hesitancy there. Let's do head tilt down. So he might have got a little whiplash that's, translating down the back. Look, I just can't get that. You try it, and you're his mom.
Yeah, he's very stubborn.
Do you see that?
Yeah.
Now bring his head down, no problem,
oh, yeah.
right? Now bring it up again. Try to point his snout up. Doesn't want to do that too easily, right? So, let me see. Good. Yeah, right there. That's the best spot. It almost makes him shake.
Yeah.
So you try it. So hold your hand here, and then bring his snout up, and you'll feel like it go right there. It starts to really be resistant.
Yeah.
It doesn't mean you can't crank it past him because he's not obstructed there. It's just all locked up, and the muscles are tight, and it hurts. So now I'm going to have you, we're going to do let me turn this lower. We're going to have this tapping instrument. It's kind of it's called a percussive instrument. Let me do it against your palm so you feel it, and you'll see this not too strong. But we're going to together come up and we're going to start to bring his head up.
It's okay, puppy.
And I'm just going to come loosen some of these segments up. And I'm definitely going to do the atlas. There you go.
Good job.
Okay.
You're okay. I know.
He's a little scared.
Okay.
Okay, so let's bring his head up now. All right, there you go.
You're okay.
I think he wants to go down on the ground, so we can also work on the ground if we need to, but let's keep going for a minute. All right, I'm also going to adjust the atlas here. There you go.
Yeah.
Now I'm going to come down the back. So dogs have 7 bones. Good. That was the atlas adjustment. Gave a little head shake, and we like to see that. So horses will do more of a licking and chewing. They'll go like, and dogs will go can't do it as good as you. So now I'm going to be in the area of 1 through 13. So here's 1. We're between the shoulder blades now. That's the withers area. And dogs have withers too. Horses, of course, are known for a withers of the horse. But anatomically, we can use the word withers, which is typically kind of T3 through T8. So I'm in that area here, and I'm looking for restricted areas or pain points. And now I'm past the withers, I'm into the lumbars, the lower thoracics, and as I come down now, this is an area that has a high incidence of IBDD. Your dog's a little young for that, but it's always possible. But it could also be an area that got strained or injured. So we're looking for that. Now we're in this area where I do feel like it being a little humped up. And I'm also watching how Blue's reacting to this spot, and that one he sits. So I'm gonna come in here like this and adjust. Ooh, that one, that's the bad spot. So I found it already. So you hold on to him and I'm gonna back it up with this. So there's the bad spot here. So the neck was bad and this part of the back was bad. So 2 areas.
Okay.
And this is his pain spot. So he's gonna squirm a little bit, but I'm gonna just release some of this anyway. And that's the worst right here. So what's interesting is that's right at the thoracolumbar junction. That's T3 through L1. Let's do a little bit more. So we're going to look, sorry, grabbing you down there. So here's your sacrum. Here's L6, L7, sacrum. Let's check the tail. Tail is nice. Let's check your leg. So I'm going to bring your leg up. The kneecap is perfect. It's not the kneecap at all. Good, the hips are good. Hold his chest because I'm going to pick his back legs up, okay? That's fine. Now I'm coming up again this way. Do you notice? I'm coming up this direction. And I'm looking for, again, in this transition area. All right, so I want to do another spot here. So let me see. Let's put him across my knee if I can. And I just want to... There, do you hear a crack?
Yeah.
Okay.
Okay.
I'm almost done. So this is it. I found it. Okay, let's put him on the ground. So you carry him down, put him on the rubber mat, okay? Give him a second to shake. There's the shake. And then you can pet him out.
Come here.
That part's done. So we're done. I got everything.
Okay, you see it? Done.
So
Good job.
he had, for lack of a better word, he had a pinched nerve in his neck and his thoracolumbar junction. Pinched nerve is more of like a colloquial term that everybody uses. Mm-hmm. And so it's a little bit more complicated than that. Right. So like, it's very easy for me as a chiropractor to just say pinched nerve, Yeah. But it's a little more complicated because segments of the bones move as a motor unit. So you'll have the one above and the one below. And they should have movement. And when they get disrupted and they get stuck and they're not gliding nicely against each other, then it causes a cascade of inflammation, ligament tightness, more inflammation, sometimes interstitial fluid buildup, and you have a whole complex component of disruption to that area. And so by freeing up the joint, releasing the nerve supply, and allowing more blood to flow freely, and the bones to glide again, in the next 2 to 3 days you might see a big difference. Okay. So we have to give it a day or two. Okay. I wouldn't mind you actually put ice on him for as much as you can for the next 24 hours. So the way that would look is you get an ice pack. You wouldn't wrap it in a towel. You would put it right on him. You could put a towel on your hand, or you could take a winter glove and use it. So if you have a glove, so you're gonna hold the towel, hold the ice pack like this on his back in that area that we talked about, which is right here. Okay? And then within 24 to 48 hours, you might start seeing him hop on the bed again. But don't expect it for at least 24 to 72 hours. Yeah, perfect. Okay? That sounds good. All right, thanks everybody. There you go.
Yeah.
Dogs have 7 bones. Good. That was the Atlas adjustment. Gave a little head shake, and we like to see that.